Jarrod's Law End-of-Year Newsletter 2025. A note from Wendy McIntyre. As we close out the year, I'm taking a moment to reflect on what we've built together and what we've fought for together. Jarrod's Law exists because my son, Jarrod, should be alive. Since 2004, I've carried his story into rooms where decisions get made, legislative offices, courtrooms, regulatory hearings, media interviews, and family living rooms where someone is desperately trying to save a loved one. This year, our work continued to prove something I've learned the hard way. Change doesn't happen because the system wakes up. It happens because people refuse to be silenced. I also want to share what's coming next, because this mission doesn't end with 1 year. In 2026, I'll be rolling out my upcoming book, Potholes in Rehab, A Mother's Fight to Reform the Addiction Recovery System. And I'm also preparing to launch my upcoming podcast, Treatment on Trial, a platform to amplify survivor voices, expose industry patterns, and keep public pressure where it belongs on the systems that fail families. The mission and why it matters. Jarrod's Law is a 501c3 nonprofit dedicated to oversight and accountability for sober living homes and addiction treatment centers, so families don't have to learn too late that treatment can be unlicensed, unqualified, and unregulated. We work to prevent unnecessary deaths by exposing fraud, abuse, neglect, and patient brokering, supporting families in crisis with guidance and documentation, building evidence that regulators, insurers, and law enforcement can act on, advancing legislation that closes loopholes and forces transparency. What we accomplished this year and what it took. 1. Families served, the work you don't always see. Behind every headline is a family trying to survive the unthinkable. This year, we continued to support families through crisis calls and urgent guidance, including 24/7's hotline support, facility verification and red flag screening, licensing, staffing, safety, billing patterns, complaint strategy, how to file, where to file, and how to document so it can't be ignored, evidence organization, timelines, records requests, witness statements, billing documentation, connecting families to resources, attorneys, investigators, media contacts, and advocacy partners. This is not advice, it's triage, and it's often the difference between a family being dismissed and a family being heard. 2. Building the evidence base, our incident and facility database. One of the most powerful tools we have is documentation. We continued maintaining and expanding our internal database tracking. 2,000 plus facilities, hundreds of documented deaths at licensed facilities, patterns of license surrender, rebranding, and continued operation, recurring indicators of insurance fraud, patient brokering, and medical negligence. This year, I personally continued the painstaking work of collecting and cross-referencing complaints, public records, and family reports, tracking repeat operators and connected entities across locations and business names, preserving evidence so it remains usable for investigations and legal action. 3. Legislative change, how I help move laws from idea to reality. People often ask how laws actually get passed. The truth is, it's not one meeting, it's months, sometimes years of drafting language, educating lawmakers and staff, building coalitions, preparing testimony, providing evidence that survives scrutiny, returning again after vetoes, delays, and political pressure. This year, my involvement continued to include briefing legislators and committee staff using real case documentation, not theory, centering survivor and family voices while protecting privacy and safety, translating forensic evidence into policy, what loophole was exploited, how it worked, and how to close it, holding the line when industry pressure tried to weaken bills or bury violations. Jarrod's Law has helped advance and defend major reforms, including AB 1356, John's Law, 60-day follow-up investigations after facility deaths, which passed this year. AB 919 bans body brokering and kickbacks for referrals. AB 425, ASAM standards and naloxone requirements. AB 877, clarifying facility classifications to prevent insurance upcoding. AB 492, DHCS notifications to local jurisdictions when new licenses are issued. SB 329, SB 35, SB 83, complaint timelines and public posting of violations. And residential neighborhoods. AB 448, AB for youth treatment rights, transparency, discharge planning. And even when a bill is vetoed, like AB 920, Jarrod's Law, DHCS licensing for outpatient SUD treatment programs, closing the sober living loophole, and AB 2087, Jarrod's Law, vetoed, the work is not wasted. It becomes the foundation for the next version, the next coalition, and the next push. My next push is the recreation of Jarrod's Law, which I drafted this week. 4. Exposing fraud and abuse, investigations that force accountability. This year, I continued working alongside families, whistleblowers, insurers, and investigators to document patterns that regulators often miss or avoid. Our work has helped expose $100 million plus in fraud and contributed to federal investigations, FBI, DOJ. Key casework we continue to track and support includes Asana Recovery, Costa Mesa. This case reflects a pattern we see repeatedly: profit first, patients last. This year, I remained involved in preserving and organizing victim testimony and exhibits, documenting patterns of upcoding, double billing, pre-authorization admissions, and recruiter-driven patient brokering, tracking regulatory outcomes and the ongoing practice of license surrender and rebranding, supporting families impacted by preventable harm. I assisted in producing all the data to support the facts and the latest major lawsuit against Asana by Blue Cross. Creative Care, Malibu, Woodland Hills. This case continues to demonstrate how facilities can keep operating, sometimes under the cover of sober living, even after serious violations. This year, I continued supporting whistleblowers and survivors facing retaliation, documenting deaths and systemic failures, keeping public attention on the gap between licensing actions and real-world enforcement. Above it all, treatment. Lake Arrowhead. This case highlights medical negligence, coercion, and the dangers of unqualified detox protocols. This year, I continued supporting families and survivors navigating legal and regulatory pathways, tracking rebranding and evasion tactics, documenting patterns of telemedicine-only oversight and dangerous medication practices. Multi-state body brokering networks. We continued tracking networks that move patients across state lines to maximize billing, often targeting Native American communities and other vulnerable groups. This year, I continued preserving whistleblower documentation, tracking facility name changes and entity connections, sharing patterns with stakeholders who can act. Alpha Connections, Apple Valley. This case remains a stark reminder: vulnerable youth are not safe when oversight fails. This year, I continued supporting the truth tellers who documented abuse, keeping attention on systemic failures and political protection, advocating for accountability and transparency. 5. Media, education, and public awareness. Public pressure matters. It changes what lawmakers are willing to do and what regulators can't ignore. This year, I continue to contribute to media interviews and investigative reporting, documentary collaborations, including projects examining the rehab industry and referral pipelines, public education on red flags, patient rights, and how to verify facilities. I was highlighted in a best-selling book called Rehab, An American Scandal by Shoshana Walters. The bigger picture, what we're changing. Our work isn't just about one facility. It's about changing the conditions that allow harm to repeat. We are pushing for closing the license surrender loophole, mandatory public disclosure of violations and surrenders, stronger operator and staff qualifications, insurance fraud prevention and whistleblower protections, multi-agency oversight, and national standards for recovery housing, real-time transparency in regulatory records. Thank you for standing with us. Jarrod's Law operates on a shoestring, often $0 to $1,000 a month, even as the need grows. We receive 10 to 12 complaints each month, and everyone represents a family looking for answers. If you've donated, shared our work, testified, documented, or simply refused to look away, thank you. How you can help right now: share our resources with families seeking treatment. Invite Wendy to speak to your organization, community group, or campus. Support our work with a year-end donation. Every amount matters. Website, www.jarrods-law.org. Hotline, 805-300-4727. Email wendy@jarrodslaw.org. Closing. I wish I didn't have to do this work. I wish Jarrod was here. But as long as families are being lied to, as long as patients are being exploited, and as long as deaths are being treated as paperwork, I will keep showing up. With only a few weeks left in this year, I am appealing to you to support Jarrod's Law with a tax-deductible donation, as it is greatly needed for me to continue work. You can Zelle me at wendy@jarrods-law.org, or you can send a check to Jarrod's Law P.O. Box 354, Rim Forest, CA 92378. With gratitude and determination, Wendy McIntyre, Founder and President, www.jarrodslaw.org.